My name is Donald Williams. I'm here at San Quentin. I work for Healthy Oakland. Healthy Oakland is a faith-based nonprofit organization. We're here at San Quentin Prison where we come and connect with parolees paroled into Alameda County. This airport attack is very important to get them at the gate, because if we're not here to get them at the gate, they will end up going to the liquor store, bars, clubs, or whatever, and to them back to their old nature of the things that send them back to prison. So this is very important for we can prevent them, to help them not return to prison. Yeah.
I got busted with some cocaine. Never been one to sell it or anything. If I was to be somebody to sell drugs, I would be my own best customer. So that's not a good business for me. You know, back in the day though, when I first got in trouble for it, it was possession of that, some marijuana. In the music business, what is there? Lots of sex, drugs, and rock and roll. And I partook in lots of all of that, and the drugs have started to catch up with me, you know.
Hey, Mr. Thurmond, where you been? How you doing, man? What's up?
Good.
Talk to me.
In '99, I was sitting in a cell in North Block at San Quentin, and I noticed I had like a fluttering in my chest. And it actually felt like a butterfly was inside my chest. I'm like, that's weird. So they did an EKG on me and they said, you're in AFib, your heart is not beating correctly.
When you talk about heart failure, you talk about the heart's inability to keep up with the needs of the body.
Okay.
You know? And so as the heart becomes a less efficient pump, then you get more tired, more energy, all these things you're talking about. That's why I asked initially what about heart failure, because that becomes the issue, particularly in terms of weight.
Yeah, I'm fighting to get back on my feet, to have a place to live, you know, let alone be able to afford medical care. And yet, if I don't have the medical care, I may not need to worry about a place to live because I won't be living.
We're finding that when we engage in these kind of systems for clients, they are less likely to use the emergency room. They're more likely to take their medicine. They're more likely to engage with me and start understanding what they need to do to get treated and take care of themselves. And that is really going to, because the model of this is prevention, you know, to provoke prevention, to stabilize and prevent.